Hi friends, welcome back to the Blueprint Nursing YouTube channel. My name is Abby and today we're going to be talking about the Neonatal Intensive Care Unit. Prior to working here at Blueprint, I was a registered nurse in the NICU, and today I'm going to walk you through what a day in the life as a NICU nurse can look like. As a registered nurse in the NICU, your primary responsibility revolves around providing care to ill and premature infants. The exact diagnosis or severity of prematurity that you encounter will depend on the level of NICU that you're working in. Levels of acuity in the NICU are the reverse of the adult world. So a level 1 NICU is a standard well newborn nursery, and a level 4 provides the highest level of neonatal care, including ECMO. Regardless of what level NICU you're working in, the bones of NICU care will be the same. So what does a day in the life as a NICU nurse look like? The shift will begin with being given client assignments, and from there, it's time to get report. This includes learning about why the baby is in the NICU, any changes that occurred during the previous shift, and any specific care instructions. Following report, you'll typically clean surface areas in the client's room. Infection control is huge in the NICU. And perform a safety check. Safety checks ensure that all rescue equipment, including items like suction, a bag mask, oxygen flow meter, and dosage sheets for code medications, are present and working properly. Moving on to performing cares. A unique aspect of the NICU and your flow throughout the day as a registered nurse in the NICU is performing cares, which typically occur every 3 hours. In the NICU, cares are clustered to promote the least amount of stimulus to an infant as possible. Infants born prematurely can become very overstimulated very quickly, which can lead to poor outcomes. So we try to reduce the stimulus by doing everything they need done at once, then leaving them alone. A great way to think of this is to remember that if a baby wasn't born prematurely and was still in the womb, what would that environment look like? It would be dark, because there's no light in the womb. So we keep them in an isolette, and until a certain gestation, keep the isolette covered by a blanket to limit the amount of light that they're exposed to. The womb would also be warm and wet. So depending on gestation, the isolette will be set to a certain temperature and humidity to again mimic the environment of the womb. And last, the environment would be quiet and baby would be left alone to grow. So we limit noise and cluster cares to provide the infant with the opportunity to focus on growing, resting, and developing. In rare circumstances, an infant will only have cares every 4 to 6 hours, but 3 hours is standard. Typically, care times that are greater than 3 hours apart are usually reserved for extremely premature or fragile infants. So what is a care time? Care times consist of performing a head-to-toe assessment, temperature check, diaper change, and feeding. Infants in the NICU are known for changing rapidly and unexpectedly. So it's important to establish a really good baseline assessment at that first care time to help clue you into any changes that may occur throughout the shift. Feedings can be provided by mouth via bottle or breast, or via feeding tube if the infant is too premature or unable to eat by mouth. So with that, cares become a big part of your day. On to medication administration. Administering medications is a common and critical part of care in the NICU. Medications can range from something as basic as oral vitamins all the way to IV drip medications such as sedatives or paralytics. In the pediatric world, medication dosages are all based on weight. And with premature infants, their weight can be as little as a few hundred grams. These dosages can be just as small and require precise calculations to ensure they're the correct amount. Another significant part about life in the NICU is providing support and education to caregivers. Having a child in the NICU can be a very stressful and emotional experience. As a nurse, it's important to help support families through this, to provide education as needed regarding their baby's care, promote bonding between the baby and the caregivers, and encourage caregivers to be as involved as they're comfortable. Thank you for reviewing NICU nursing with me today. If you have any questions, feel free to comment them down below. Don't forget to check out Blueprint Nursing's other social media platforms, including our website, for lots of NCLEX prep resources. See you next time!